All right. Welcome back to the show, everybody. I've got my special guest, Dr. Becca Rodriguez, and I wanted to do a proper introduction to her because she is amazing. She used to be part of San Diego Sports Medicine, but she is now with OasisMD and Encinitas. And the list goes on the types of athletes she takes care of. But I'm going to close my mouth because there's a lot for me to try to remember because she's well accomplished. Um, Dr. Becca Rodriguez, how are you today? Good to see you.
Great, Mark. Thanks for having me. Super
Uh,
excited about this segment.
I'm excited to have you. As you know, I've really gotten heavily into mountain biking, and having you on the show and talking about CTE and anything else that may come up around the athletic world, I'm really excited to bring that out there. And before I do, just wanted to tell everybody, Dr. Becca Rodriguez is a medical physician, but what she's going to share with us on the show today isn't actually going to be medical advice. If you do need help or you are injured, please seek your physician or even reach out to Becca Rodriguez and we'll give you the proper contact information for that. Just needed to get that out there in case we needed to. But yeah, without further ado, Dr. Rodriguez, can you give us a little bit of history on who you are?
Sure. So I'm a family medicine and sports medicine osteopathic physician. And so I've been in practice for about 10 years now and really pretty much get to see everybody from babies to elderly adults and really focus in on sports medicine. So I've been fortunate to work with the local high schools here in San Diego, all the way up to the Olympic Training Center in Chula Vista. Currently, the teams I take care of right now include San Diego Legion Major League Rugby here in San Diego, and the San Diego Ballet, City Ballet, California Ballet, and also I'm team physician for USA Women's Waterpolo and USA Men's Rugby. So, of course, right now, sports has been kind of low key. And so, your segment here with people really getting into mountain biking and, different sports than they did before is perfect to talk about. And definitely, looking at some of the medical aspects, things to look out for brain injuries.
Yeah, that's really, really important for a lot of us, especially the folks like me who are just learning and trying to learn how to fall gracefully, if I can, at an older age. um,
Got it.
One of the things you had mentioned, you go down there and you work at the Olympic Training Center, but tell the folks a little bit about your experience because in the last World Olympics, you were called as one of the medical doctors there. Can you give us a little bit about that?
Yes. So I was able to serve Team USA and the US Olympic Committee over in Rio in 2016 as the medical director for our high performance training centers. So I was able to look after 11 different teams, so a lot of different athletes, and just coordinate and work with great team to really take care of the athletes and provide the best care for them. So yeah, super exciting, and might get to visit Brazil again coming up in summer 2021, working on the medical commission for the USA Deaf Olympics. And so we'll see. Got to brush up on that Portuguese.
Yeah, that's amazing. You're always doing so many great things. I know a lot of that doesn't just get handed to you. A lot of that's through hard work and dedication and the passion that you have to help out people and help out athletes. For the folks who've ever seen Dr. Rodriguez in office, you'll see that there are so many high caliber athletes on the wall, from racers to, I mean, UFC fighters. I mean, you name it. They all seek her out, and they do it for a reason, because she's great at what she does.
Thanks,
Uh,
Mark.
yeah, of course. So, wanted to get into CTE because that's something. There's so many people out on the trails. Obviously, with mountain biking, a lot of us are pretty strong-willed and pretty stubborn when we're injured. And we also, when we get on the trails, we don't want to really go home if we crash. Especially if we have families at home and this is my 2 hours. This is the only 2 hours I get today. um,
Totally.
but take us through CTE, because it's a term we hear, but what actually is CTE and how can it affect us, and when do we know if we have it?
Yeah, so great question. So CTE, chronic traumatic encephalopathy, has to deal with an injury to the brain. And so usually that's kind of a jarring motion, kind of front and back, that happens to the brain with a head hit. And so, again, if you're going to be mountain biking, cycling, and you head over those handlebars or even, to the side, um, if you're hitting your head, if you even have your helmet on, and you happen to look at it, if it has any cracks in it, I mean that's a pretty good high chance you have a head injury. We look to see if you've had any of that jarring and any type of neurological symptoms that follow after. It might not happen right away, so you might like throw on your helmet again, or just like, kind of be a little startled, jump back on the bike and head home. Next thing you know, you might be hitting up with a headache. You
Mm,
might start feeling nauseous.
mm,
You might have some vision, hearing disturbances, as dizziness. Things may progress, and
mm.
there's some danger signs to take a look for as well. But symptoms can be immediate, right after an injury to the head, or they can be hours later. And so,
Wow.
if those are some of the things that a person feels, even getting back from the ride, or even just kind of like trucking back, like trying to limp back in, to their home after the fall, that's what we kind of look for, is specifically, the headache, vision, hearing changes, dizziness, just not feeling right, even brain fog, where you may have a conversation with somebody or be trying to think of something and you just don't have that mental clarity and sharpness like you did before the fall.
Interesting. Now, wow, is there a common symptom from a brain injury that's kind of like your classic, like, "Ooh, yeah, that really sounds like CTE," or could it just be all over the place?
Really, everybody's body is different. And so, our immune system, our hormone systems are different. Um, our intensity of exercise, diet, supplements and things like that. So it really kind of just is individualized. But I mean, I think looking at a headache and probably some of the dizziness and brain fog, those are
Mhm.
kind of the top three that we see
Okay.
in people that have brain injuries from, you know, traumatic head hits.
Gotcha. And you had mentioned that if you do hit your head, and you take a look at your helmet, and there's like, obviously there was some speed to that impact, or there's pressure. You see visual signs on the helmet that there was definitely a hit. Um, do you? I guess the question there is, how do you know when to turn it in? Is that individualized on the person who's writing? Like, ooh, I should just be careful, or is I mean, I guess it's hard, huh? Because it could be symptomatic right away, or it could happen later.
Yeah, so I think like the thing about looking at the helmet, once you've had a fall, is to check to see how much force really went through that helmet to your own head.
Mm,
The helmets kind of, will be varied between individuals, because some will have a little bit more protection, some will have less protection, be less high tech. And so I think just taking a look at that helmet after you fall, if you don't see anything and you're feeling okay, you probably still want to head back home off the trail, and try to monitor and see if you get any symptoms that develop. I think that if you look at the helmet and you see a crack and there's some damage and stuff, obviously, there's been a strong force. And
Hmm.
so those symptoms might be immediate, they might be later on. Again, turning back home to try and monitor for symptoms is going to be key. And then, some people have their GPS, watches, phones, some way to alert somebody like, hey, I had this injury. I'm going to try and make it back, but just in case, like, here's where I'm at. I think that's important in case any of the symptoms come up, even during coming back from the trail. Um, as far as like, once that happens, and if you experience any symptoms immediately or even hours after, that's going to be important to contact your doctor and really get screened for concussion.
Hmm. Okay. Yeah, that's great advice. And say you are calling your doctor and you do have those symptoms after a good crash. What's the danger? I know in CTE, one of the things I was reading is actually is there degradation to the brain?
Yeah, so we look at when you're over at the doctor's office, really looking to see if there's any neurological symptoms that keep persisting. If things are going to be where you're progressing in severity,
Mm,
perhaps you're going to get vomiting, perhaps you're going to get slurred speech, you're not going to be able to really get out the words that you want, the gait is going to be off and like to the side.
oh,
Those things are going to require a lot more workup, possibly in the hospital with imaging. And
mm,
so there they can actually, through imaging, MRI mostly, but CT scan is important too of the head to take a look at changes in the brain. And so changes in the brain for CTE can show diminishing of the actual like sub the brain matter. You can get kind of shrinking down of the tissue. You can
really?
see.
Wow.
Yeah, it's pretty crazy to see on some of those MRIs. And like, I don't know if you saw that movie Concussion with, Will Smith, how he was going through all of the images and taking a look at all these, pro football players that had these head injuries from tackling and whatnot. Um, they're showing the change in the brain tissue, the brain matter. You can also probably see decreased blood supply. So that's pretty big time too. And
Dang.
yeah, yeah. So, those changes with the imaging studies are going to be important to take a look at. Most people are pretty lucky that if they end up getting a concussion and they're having it looked at pretty closely and monitored, they're going to do fine, and they're going to get that brain function returning, the dizziness gone, the headaches gone, things like that.
And
Um, yeah.
and how long does that typically, well, I guess a twofold question. If you do take a fall on the trail and you say, I'm gonna go home and monitor myself, what's the length of time that you should monitor?
I mean, for sure, you want to take a look at if you have any symptoms within like 4 to 6 hours, maybe even 8 hours of
Mm,
your fall. But some people
mm.
can experience it even 24 hours later.
Oh,
So,
wow.
yeah, so probably like a good, 24 hours to see if you develop anything will be big time to take a look at.
And then when you do have the, sorry, my son's in the background trying to break down the door, everybody. Sorry about that.
No, no, no problem. Mine's probably right behind yours. Going to be doing that soon.
uh, um, and then when you do have symptoms and you go in and you are diagnosed with CTE, how long does that healing process typically take?
So if you look at somebody that has concussion, we know that typically it's going to take you about a full week for that brain tissue healing, swelling, things like that to kind of calm down. If people go into um, more of the severe type cases, that's going to be longer. I mean, we could see a person with symptoms trying to recover for like a month, maybe longer. The other part that's important to look at is someone that gets multiple head hits. That's going to lead more towards the CTE. The other part is that if they get something like one head hit and then shortly after they get another one, that is something that can be a risk factor for CTE as well. And so, we look at how many concussions you've had in your life, and try to gauge it from there, along with the severity of symptoms and findings to see if you have CTE, and then, try and get a good medical team around them for support.
If somebody were to need a physician because of CTE, should they go to sports medicine physician specifically, or should they start with their family practitioner and go from there?
Yeah, so probably headed over to sports medicine. So a primary care sports medicine physician is going to be your best bet. And the reason why is because we're really trained in depth to examine what's the mechanism of injury, what's the protocol, who do we build for your medical team, and that may be a psychologist, it might be a sports dietitian, it might be a psychiatrist if people start having mental changes like depression or anxiety, panic attack come up, even like post-traumatic stress disorder from just a fall. And also monitoring, and then getting them set up with a good concussion physical therapy. So there is such a thing as concussion physical therapy. And usually they try to focus in on the eyes and the ears and balance. So we call it vestibular ocular physical therapy. And so that is completely different than a person would go in for like neck pain or low back pain. So there are a lot of different steps that likely primary care might not be able to manage all of that in depth. So yeah, so we would say try to find a sports medicine physician that can really be detailed, because that's a lot of our training within our fellowship.
That's really good advice, because that would probably cut back on the amount of getting referred out as well, so you can get in and kind of get treated right away for the CTE or the concussion. And
Totally.
and then I heard you refer to concussion and CTE, but two different things. Is that correct?
Yeah, I mean, like, we kind of say head injury, and if you experience any neurological symptoms, you have a concussion. People that have had a really severe concussion can progress or get that diagnosis of CTE. People that have the repetitive head hits can progress into that diagnosis of CTE, and that's where usually we're going to see those changes on the imaging, with the brain matter shrinking, and then also like the decreased blood supply. And you might see, again, people with CTE later on down the line, they may progress into not being able to speak as well, not having as good as memory, not being articulate, functioning fully, being able to be very coordinated depending on what part of the brain was affected. So that's kind of, something to take a look at for there.
Yeah. Hey, buddy. Good to see ya. That's really good. And I was actually going to ask that question for somebody who's like, who cares? I hit my head. How dangerous could it be? But
Right.
yeah, that's pretty severe. And that type of damage, could that be permanent if it gets to that
CTE
level?
level? Yeah, absolutely. When it gets to that CTE level, absolutely. That's, permanent and usually progressive, and there's a lot of specialist neurology involved with that. Sometimes the physical medicine and rehabilitation doctors as well will be in there. So yeah, a lot of different specialists.
Wow. That is that yeah, definitely serious. So guys and girls, if you're out there on the trails and you do take a pretty traumatic fall and hit your head with a lot of force, this is great information to know to take it serious. Pull out there and head home. In fact, one of the audience members, Joey Yates, right here, great advice to let someone know that you fell and are heading home. Yeah, that's great advice. Just in case something symptom wise progresses on your way out. So, Strava has the beacon feature. You can GPS your location through that on the free feature through Strava. I think it's Trail Forks. They have one as well. I think all of them have it pretty much nowadays, where you can set your GPS and if needed, help can find you.
That's
Uh,
great.
yeah. So, wow, a lot of good information on that. Is there, if you guys in the audience have any questions, we probably have Dr. Rodriguez here for a few more minutes, but does anybody have any questions specifically regarding sports medicine and things like that? And if you guys are typing that in, Dr. Becca Rodriguez, do you see common injuries or things that come from mountain bikers or cyclists? And if you do, what are some of the best ways to kind of heal up those things?
Yeah, so that's a great question. A lot of the common injuries that we see in mountain bikers and are going to be abrasions. Because if you have a fall, if you end up, slipping, you're riding by something and it kind of like snags the skin. So I think wound care is a big topic to take a look at, and just making sure, as soon as you get to a place where you can wash with soap and water, clean that abrasion, that cut off, and then, make sure it's bandaged well. Maybe you're applying a little bit of some triple antibiotic ointment or like some neosporin, and then looking for signs of infection. And
Mm,
that could be redness, swelling, it could be drainage from that wound. um, so that would be definitely get to the doctor so they can take a look
mm,
uh, and see if you need some oral antibiotics. The other thing is we actually see, crazy enough, a lot of fractures because of the fall. Um, so preventive wise, I think just, you know, making sure to kind of scope out the trail, know a little bit about it before you go on it. Maybe talk to some friends that have been on it before. If they say, hey, this area is like super rocky or super steep, then, when you're going to be coming up on it, you can kind of, be a little bit more cautious. Um, so I think that's important to do. Fractures, you can't really give too much preventive advice on that. If it happens from the trauma. Um,
yeah.
Definitely that would require, kind of the same thing, just alerting someone, let them know what's going on, getting to the doctor. That way we could image and treat appropriately. And then, yeah, definitely the head injuries, that would be the third, when a person falls and hits their head in any way, even if it's light force or a pretty strong force. Anybody could have some of those neurological symptoms like headache, dizziness, foggy brain that come up. So definitely visiting the doctor for that and checking it up would be good.
Mm. That's really good. That's really good. Lastly, I was going to ask, as far as the human body and the muscles and in the preventative realm, for us mountain bikers, or I guess just athletes in, you know, in general, but maybe more so on the mountain biking side,
Mm.
what would you say are the key muscle groups that we could work on off of our bike to prevent some of the common injuries that you see coming in from mountain biking?
Yeah, that's a great advice. Yeah, great question for, talking about for advice. I think that looking at, of course, the leg strength, so lower extremity strength and balance is key. I think, working on mobility is big time. We've seen a lot of shift for training incorporate mobility over the years. And one of my favorite books for mobility is Becoming a Supple Leopard
Mm.
by Dr. Kelly Starrett. And my husband introduced me to it because he was just finding, getting different injuries with different sports and things like that. And so this really helped to make the joints more mobile. So if you really have to do
Mm.
something where the bike slips and your arm goes out,
Mhm.
you're going to be, because you work on your mobility, your external, internal rotation, you're doing, a lot of like flexion, reaching up and extension back. I mean,
Mm.
those type of things within the book exercises you'll get to see that could save you from rupturing a biceps tendon
Mm.
or
Mm.
pulling a muscle because you're working on that mobility within your joints. I think the quad strength, hamstring, and then gluteals for sure are important to work on. A lot
Mhm.
of people just to kind of assume when you do any sport, you're strengthening the glutes all the time. And fact is that there's pretty focused exercises for the glutes, especially the gluteus medius is a key muscle to really work on for strength. And so our glutes are for balance as well. When we stand on one leg, our glutes activate to help us
Mm.
to balance there.
Hmm.
So I think that people often forget the glutes. So really working on that would be good um, because it's your lower extremities. Your hands are just there to kind of like help with the balance and whatnot. If you're
Mhm.
getting any like soreness and things like that in the forearm, you're probably gripping too tight.
Mm.
If you're feeling a lot of strain and pain in the hips, perhaps looking at what that seat height or the pedals look like are going to be something to kind of adjust and accommodate to decrease that hip tightness and pain and things like that. So, yeah, I think
That's
lower extremities for sure.
that's wonderful, and, yeah, I will definitely be working on that. I can need to do that more so, when I'm off the bike, and then I recently bought a percussion device, called a Theragun,
Yeah,
and
that's
I
big time.
yeah, I've been trying to hit that on my hips because I get it in my hips, like, side backish, like, upper gluteal area.
Yeah,
So when I do that, it kind of relaxes everything. I know you got to
sure.
jump in a little bit because I know you got the kiddo there. By the way, she does it all, folks. She's super mom doctor today. So thank you. Got a couple folks here chiming in. Case study says maybe it's been covered, but if not, what protocols should we be followed in recovering from the head trauma? I know brain rest has been an old standby, but are there more productive measures that can be taken?
Yes. So that's a great question. Definitely after you see the sports medicine physician, they're going to put together a return to training or return to kind of play protocol for you. And there's a standard that we use, kind of going from light aerobic exercise all the way down to strength training. Um, Full contact, and that could be, the jarring and the jumping, moving around of the bike for mountain bikers and things like that. And the progression is usually over about a week's time. So as long as those 5 days, you're not getting symptoms within 24 hours of training, then you're progressing through within 5 days. I think the thing to note is that people often forget about their diet and hydration. So you don't want to become dehydrated. So really making sure you're having enough water and electrolytes during this time of head injury is key. Making sure that you look at fish oil. There's been many studies that we use high dose fish oil, like 3 to 4,000 milligrams a day, in people that have brain and head injuries in order to really help repair the neurons, and so that's probably another good point to look at, and with the fish oil. So
Wow.
yeah, you're looking about a week week's time, 5 days. Most people can go through the concussion protocol with like return to training. And that's important because you could just, have a head injury, have a headache. It goes away within a couple of days. And then you're trying to hit the trails again and you're just like all in 100%. And then all of a sudden you're like, whoa, something's not right. And you start getting like dizzy and things like that. So that progression of really like challenging the heart rate, like a little bit, building it up moderate, and then really having that high intensity, increased heart rate up to that max heart rate towards the end of the protocol is huge, so that we can really know you're safe to bring up that intensity for your desired exercise.
I love that. Wow. That was a case study. Great question. That was wonderful. Yeah, I was out with Joey Yates, who's in the audience this morning, and man, I looked at my heart rate monitor. We hit the red a bunch of times. So good ride this morning,
Yeah.
Joey. We can end it on this one here. Obi-Wan Todi, what's up, buddy? I love this guy. He says, "What's up, guys? Sorry if it's a bit off topic, but so happy that they're including breakdancing and skating in the 2024 Olympics. That is cool. That is cool."
I just got a text message from my husband this past week about that. And then I got to look it up a little bit in the media. And so, like, yeah, super stoked because as a past professional dancer, I did breakdancing back in the day where my dad brought the cardboard down and, we were having dance parties with breakdancing and things like that. And so I actually gave a pretty good lecture at our National Sports Medicine Conference for the American Osteopathic Sports Medicine Association on breakdancing. And it was in Las Vegas where I was able to make the connection with the Jabberwockies. And
Oh,
so
that's
I actually
awesome.
had a couple of them come in and demonstrate some of the different moves so that us doctors could learn about it and really kind of like break it down about like neck injuries, head injuries, which, ties in for today. And so, yeah, that's big time. I'm super stoked. Like, if I can get involved with that, I'd be so stoked to be with the breakdancers.
Yeah, you'll be the one right there, which is going to be awesome with the Jabberwockies experience. Obi-Wan Todi says, "B girl Becca, that's awesome." Also, fun fact, Dr. Becca Rodriguez at one point was Power Ranger, but that's a whole different podcast, right? So,
Past dance days.
that's right,
Yeah.
past dance days. Case study says wild styling. So if anybody is in this area, and probably even virtually, and they're injured or are seeking a sports medicine doctor, Dr. Becca Rodriguez, can you tell the folks out there how they could get a hold of you or potentially even see you if they're close to here, or even if you're doing virtual from afar?
Yeah. So great. I am doing telemedicine video visits along with in-person visits. And so we screen everybody for COVID and use all the high safety techniques and protocols before people are coming into the office. But best way is to take a look at my website. It's Dr. Becca, DoctorBecca.com. And at the bottom of the page, there's a request an appointment. And you can also, so it's all together, DOCTOR Becca, BECCADO.com. That's important to just kind of fix on their mark. Sorry.
I got
And
the.
then
I got.
you can also even call the office. And so that's at 760-846-1654. Or even reach out through Twitter. And so I'm at SD Olympic Doc, SDOLYMPICDOC is my Twitter feed. So either way is great. And yeah, happy to help provide any information, assessment, treatment plan. And again, it's usually a team approach. And so, yeah, other than that, keep safe, keep riding, keep out there getting that blood flow, through the lungs and staying in shape. That's most important for sure.
I love
Having fun.
it. Having fun. You got a new nickname. We're gonna start calling you B Girl Becca Styling. Well, Dr. Becca
Yes.
Rodriguez, I really appreciate your time. Olympic level physician here, also the physician to many professional athletes out there, too many to fit on my piece of paper. And I would love to have you back on the show. We could always talk about other things that people would like to hear about. But thank you so much for today's information in and around CTE and the protocols there for us all. So hope this podcast helps you guys out. And Dr. Becca Rodriguez, thank you so much.
Yeah, thanks for having me. Look forward to coming on back.
All right. See you guys. Thanks for coming on. See ya.
Thanks.
Woo!